Hello, welcome to your lecture on substance abuse. Today's lecture is going to focus on tobacco, particularly smoking tobacco. The health-related risks associated with smoking tobacco are it's one of the most preventable causes of death in the United States. Coronary heart disease is increased by 2 to 4 times, as well as stroke 2 to 4 times in your patients that smoke. Lung cancer is increased 25 times in these patients. So smoking can cause cancer just about anywhere in the body. Particularly we see it in the lung, but it can also cause cancer of the bladder, cervix, colon, and so on. Smoking causes cardiovascular disease, COPD, stillborn, preterm delivery, low birth weight, sudden infant death, osteoporosis, and smoking decreases the immune system. So encouraging your patients to quit smoking can decrease their risk of cardiovascular disease after just 1 year. It can decrease their risk of stroke to that of a non-smoker in 2 to 5 years. It decreases their risk of mouth, throat, esophageal, and bladder cancers by 50% within 5 years, and it decreases their risk of lung cancer by 50% in 10 years. In 2012, $9.6 billion, or 26 million a day, was spent on advertising tobacco. The United States is the 4th largest grower of tobacco. We are exceeded only by China, India, and Brazil. North Carolina, Kentucky, and Georgia grow 80% of the tobacco produced in the United States. Tobacco is associated with $170 billion in direct medical care, over $160 billion in lost productivity. $5.6 billion of that is coming from secondhand smoke. So nicotine is indeed an addiction. Nicotine addiction is higher than any other drug in the United States. Nicotine is as addictive as heroin or cocaine. So the nicotine releases dopamine in the brain, which creates that pleasurable sensation. Withdrawal, on the other hand, can cause irritability, nervousness, headaches. Often it causes weight gain. The addiction to nicotine is both physical and emotional. So physically, the body wants that pleasurable sensation that they're getting from the dopamine release. But emotionally, smoking is often combined with something pleasurable activity, or with a task. So oftentimes patients will say that they smoke when they drive, or they smoke after a meal. They may smoke when they drink alcohol, or they may have to have a cigarette before they go to bed. So these are some of the barriers that you're going to have to discuss with your patients and help them figure out how they're going to get around when they want to stop smoking. Electronic cigarettes have become very, very popular. They're often promoted to be safer than traditional cigarettes. There's actually very little evidence on their safety. They're thought to deliver nicotine without any of the other harmful substances such as tar. However, testing of some of the chemicals in these electronic cigarettes has found toxins such as formaldehyde and acetaldehyde. Currently, e-cigarettes are unregulated. They are often thought of as an aid to smoking cessation, and they're very popular with youth. So let's talk a little bit about some of these myths. Currently, electronic cigarettes are unregulated by the FDA or any other organization. Therefore, we are unable to determine the safety or contents of the chemicals that are put into electronic cigarettes. As far as electronic cigarettes being an aid to smoking cessation, there is zero evidence out there that this actually works. Because electronic cigarettes are currently unregulated, there are no age restrictions placed on electronic cigarettes like there are on traditional cigarettes. Some states have actually banned selling electronic cigarettes to minors. However, minors are often still able to have access to electronic cigarettes by ordering them via the internet or getting them through kiosks that are often located in convenience stores or malls. The flavors of the chemicals that are put into these electronic cigarettes are often appealing to youth. Flavors such as bubblegum, mint, and fruit, just to name a few. So in 2010, 7 out of 10 smokers said that they wanted to quit. However, only 4 to 7% were actually able to quit without our assistance. 25% were able to quit for at least 6 months with a little bit of pharmaceutical help. So your role as the provider is the 5 A's. Ask every patient at every visit if they smoke. Advise your patients to quit, stay positive, help them realize the health benefits associated with smoking cessation. Assess their readiness to quit. If they're ready to quit, then assist them. Help them to set a quit date. Develop a plan. Offer medications that can help them. Offer to get them some counseling. Discuss their barriers and help them figure out how they're going to avoid these barriers or get around them. Arrange for follow-up visits. Make sure that you're checking in with these patients periodically to see how they're doing, making sure that they're staying on their medications that will help them and help them to figure out how they can get around these barriers that's ongoing. So arrange for follow-up visits with these patients. So let's talk a little bit about some pharmacological treatment. Probably the best known and well-studied medication that is currently available to us is Wellbutrin, also marketed by Zyban. We start this medication at 150 milligrams a day for 3 days, and then we increase to 150 milligrams twice a day. You are not able to give this medication to patients that have seizure disorders because it can lower the seizure threshold. So another medical option that we have is Chantix. Chantix we give at 0.5 milligrams a day for the first 3 days. Then we go 0.5 milligrams twice a day for 4 days. Then we go up to 1 milligram twice a day for 11 weeks. Chantix can cause some neuropsychiatric symptoms such as really vivid or bad dreams. Sometimes these dreams are so vivid or horrific that it will cause the patient to discontinue this medication. So again, this is another reason to have a lot of follow-up with these patients. Some of the nicotine replacement therapies that are available, some of the inhalers and nasal sprays are also only available by prescription. So some of the non-pharmacological treatments that we have available to help these patients are nicotine replacement methods such as the nicotine patch, the nicotine gum, nicotine lozenges. We also need to offer these patients counseling. Education. We need to talk to our patients. We need to educate them that withdrawal symptoms usually peak within the first 3 days. They may experience a mild depression. They may have weight gain, so we need to help them plan for this. Often this is a reason that patients, particularly women, will return to smoking because they don't want the weight gain that's associated with stopping. So we need to talk to them about this, help them plan for this, talk to them about a healthy diet, maybe starting an exercise routine to prevent this weight gain that comes oftentimes with smoking cessation. So this slide just gives you some helplines to give to your patients that want to stop smoking. These are free services, so encourage your patients to use these.